Community Health Board, November 5th, 2019. And the first item of business on the Community Health Board agenda is to approve the minutes of the May 7th, 2019 Community Health Board meeting.
I'll move them. Second.
So I moved and seconded to approve those minutes. Any discussion? Seeing none, all in favor, please say aye.
Aye.
Aye. All opposed, same sign. Motion carried. Thank you. The next item and the other item on the agenda is a report from our staff in this area. I think Lisa Brodsky is going to get us started. Thank you.
Good morning, Commissioner Brecky and Commissioners. As always, we appreciate the opportunity to come and speak with you and kind of highlight some of our work and some of the data and what's going on in the health of our community. Today, we have a few different programs and some data to share with you. We're going to start with our follow-along program with Terry Furman, and then we're going to review just kind of some snapshots on the Minnesota Student Survey that just came out, and we just recently received the data. And then we're going to focus on alcohol, tobacco, and other drugs, give you some examples and information of trends that are in our community, as well as talk about our current coalition, our new current coalition work plan that we just finalized last week, actually. So I'm going to turn it over to Terry Furman, who's going to do the follow-along program.
Good morning, Commissioner Brecky and Commissioners. I'm Terry Furman. I coordinate the Follow-Along program in Scott County. And I just thank you for the opportunity to share a little bit about Follow-Along with you this morning. So Follow-Along program is a program within our family health programs. And our mission with family health is to protect, improve, and promote the health of families with children in our communities. And the impact that we're looking for is that children have a healthy start in life, and families have support to parent well. And then, as you can see, also parents are informed of benefits and resources available to their children to have a healthy start in life and maintain a healthy life. You can see it's that healthy start is really the mission and the focus of what we do in our family health programs. So Follow Along is one of the programs in family health where we help parents track their child's development. We put the tools in their hands to do that. We provide age-appropriate activities for parents to do with their child, and activities that are developmentally appropriate to support that development. We also help parents with next steps if there are concerns. And then Follow Along promotes healthy child development and family resiliency by aligning resources and community partnerships directed at prevention and early intervention. And so early intervention is kind of the key of Follow Along. So we look at why early. We have a lot of science around that. So early experiences affect the quality of brain architecture by establishing either a sturdy or a weak, fragile foundation for all of learning, health, and behavior that is going to follow for children. So if you look at the graphic, there's a little yellow line that shows the time where those sensory pathways, such as vision and hearing, are developing. And then there's the blue line that shows on the graphic where language circuits are being developed in the brain. This is before we even see children talking and hearing a lot of words coming from them. And then we have the higher cognitive functions that follow on the red on the graphic. That pink area is the first year of their life. So we can see that the development starts prenatally, but it really accelerates, and there's a lot of development going on in that first year. And that's why that is so, so important. The other piece that's important about this graphic is the circuits that are developed early, those basic circuits. Those are the circuits that the later, more complicated brain architecture is going to build on for later complicated components of the brain that are needed for further or future learning. Also, why early? The brain's capacity for change decreases with age. So the brain, it's most flexible or more flexible or plastic early on in life. So if you look at this graphic, it shows when a child is 2 how flexible and plastic that brain is for change, and it decreases significantly in those first few years. So through early childhood and early elementary, there's still a lot of capacity for change, but a huge, huge opportunity exists in those first few years. And then we all, it changes for us later on as we progress in life. Early preventive intervention is more efficient and produces better outcomes than remediation in life. There's a lot of science and research to support that. Another thing that is real important to remember, and that we have science and information about, is that balanced approach. And that approach to social and emotional, cognitive and language development, that's what will best prepare all children for success in school, as well as later success in the workplace and in life. In addition, supportive relationships are important. Positive learning experiences, those begin at home, we know that, but they can be provided through a range of other services that have proven effectiveness. Babies' brains, at the very, very earliest stages, they need those stable, caring, interactive relationships with adults. And any way or any place that that can be provided, there will be a healthy benefit for that early brain development. And then additionally, science demonstrates that in situations where there's toxic stress, that's likely, and we've had a lot of discourse about ACEs and adverse childhood events. Intervening as early as possible is just critical to achieving the best outcomes. So for children experiencing toxic stress, those specialized early interventions, those are needed to target not only the cause of the stress, but also to protect and mitigate for the child what's going on now because of what has been going on. So the follow-along program, our focus is on those first 3 years, those first 1,000 days. All families in Scott County with children birth to 36 months are eligible. We send out an invitation for all new births in Scott County, but parents can enroll anytime. And so we do have parents that enroll at 16 months one time. They're worried about their language, and then we never get another question or return from them. That's okay. This program is designed to put parents in the driver's seat. They can use it as it is helpful to them. We have about 600 families a year, and then we can see that on the next graphic. We average about 200 new enrolled families each year, but 600 active families throughout the year, and then between 30 to 60 referrals a year as we identify children and try to connect them to services. So Follow Along is a screening program, so it's real important. If we look at the bottom graphic, screening is a short, easy to complete formal test. It's a validated tool that we use, and it's just to identify children that may benefit from further evaluation and possibly additional intervention. Excuse me. So we have, we send questionnaires every 4 to 6 months. Excuse me. And we use two questionnaires. We use Ages and Stages questionnaire, so the ASQ3, which evaluates motor, cognitive, language, and social and emotional skills. We also use an ASQ SE2, and that's a social and emotional screener. And that takes a look at children's ability to experience and express and manage their emotions, develop positive, healthy relationships, and then also to explore their environment with curiosity and confidence. So we know, I talked previously about that balanced approach with social, emotional, as well as those cognitive pieces. We want to monitor both of those. It's kind of a bricks and mortar. If children don't have those social emotional skills, it's hard for them to relate to other adults, teachers, caregivers, and to learn. Also, if they don't have that confidence and that curiosity about exploring, it's pretty hard to get them to the library to explore and to have those opportunities to learn. So it's a bricks and mortar approach. We're looking at their cognitive and other abilities, as well as those social emotional pieces for children to identify earlier. And then for 80% of the families, they return the questionnaires, and we send the results, activities, incentives back to the families in the mail. And then if there are concerns, and that's about 20% of the time, a public health nurse calls and parents are provided information. And that could be specific to parent questions and concerns. They write those in on the questionnaire, and we always respond to those. Or we do, in addition to following up if there's below cutoff concerns, we do follow up if they're close to the cutoff. So they might be in what we call a monitor area. We want to give that information to parents, and then we provide them with skills-specific activities so they can enrich that area. And then we always also answer questions relating to parenting. And additionally, besides providing information, we also connect parents to resources. So this graphic just shows services that we connected parents to in 2018. And the bulk of the services are the Help Me Grow referrals and the medical referrals, but there are a lot of other services and resources we connect parents to in the community. The biggest one you can see are the early childhood programs. And so we have multiple services that are available and resources for parents in public health, CAP agency, libraries, and in the schools. So we connect parents to those, as well as health medical services, food support, and financial supports, because those are all really important for families when they are raising their children. And then We also refer parents for assessments. And so we are a screening program. At this point, when we refer them for an assessment, it's a little different. It's a very complex process. It's administered by evaluation specialists. And this is where it will be determined if there is a delay and the extent of the delay. And then also if a child is going to be eligible for services. We do a dual referral. So we refer them to Help Me Grow, which is a central intake through the Department of Education. And then we also do encourage a medical referral. You can see there's a disparity between the 28 referrals we have for educational and the 20 for medical. That's again because parents are in the driver's seat. Some parents want to do one and not the other. So the dual is important. There can be medical things going on for a child that's impacting their development. And a real simple one is we'll see communication scores lag. We want to make sure that the doctor has that information. They'll look at their hearing, and oftentimes they'll do a medical treatment such as PE tubes, or otherwise the hearing will be improved and the communication resumes back on track. So it's a very easy thing in some situations, but that dual referral is important to provide a whole view for the children. And the results of our program, this screen shows the age of identification of the concerns, and this is for children that qualified for services. And so you can see it starts at 4 months through 24 months. So we are finding children early, and that is the goal of this program, and helping parents connect to those services so they can start the intervention pieces for support. I have a story about one particular child in Follow Along. Ellie is my grandchild's name. It's another child. But little Ellie started showing some concerns at 8 months. She was following in a monitor area, which is close to the cutoff, not beyond. By 12 months, she was beyond the cutoff. And at that point, we referred her to the educational referral, which is Help Me Grow. And then we also followed and did a referral to her healthcare provider, so they had that information. This parent showed an in-between interval 2 months later. She really wanted to know what was going on. And you can see by 14 months, she was now below the cutoff in 2 areas, and additionally in a monitor area in a 3rd area. By this time, she had been assessed and evaluated, and she qualified for early intervention services through the school and started receiving those services. At 2 years, she continued below the cutoffs, continued receiving services. By 30 months, we can see she's no longer below the cutoffs. This little girl was above the cutoffs, but close. So she was in a monitor area, and she continued in those early childhood services, but the services were decreased. All she needed at that point now was speech. She started with more services, but they changed those as her needs changed. At 33 months, she was above the cutoffs, not even close to the cutoffs anymore, not even in the monitor area. She's continuing to receive services, and they've added some monitoring by an audiologist for potential hearing concerns that they're watching. I am excited to see what she does at 36 months, has yet to be seen, hopefully soon. So her story demonstrates what research shows us, and the research findings are that 1 in 3 infants and toddlers who have received early intervention services did not later present with a disability or require special education in preschool. So there's a lot of benefit to really finding these children early and supporting them and providing support for them and their families. So the first 5 years have so much to do with how the next 80 turn out, and I like to think the first 1,000 days or 3 years especially. We all appreciate the opportunity to support our families and children in those early years. So thank you.
Thank you, Terry. Any questions for Terry or comments? Yes, Leslie.
Madam Chair, I just want to say, I went out with Terry on a visit, and with one of her youth, the parents allowed it, trying to see what we do and the opportunities they have. And watching her interact with this young boy that was at risk, and how he had come along and was now going to be kindergarten ready, kind of the same story as Ellie. And when Terry walked in, he and the mom just beamed, and the support and the relationship that had built there and the passion that came out of Terry to help this young boy, it was just amazing. And so thank you for all of that work and helping these kids get ready, because everything shows that those first 3 years, 5 years are critical to their development and the work that you guys do. It was just incredible.
Well, thank you.
Thank you.
Okay, thank you.
Good morning, Commissioner Brecky and Commissioners. My name is Teresa Fouch. I'm the Data Planner in Public Health, and thank you for the opportunity to present this morning. I'll be talking about the Minnesota Student Survey, which was just released for 2019. So first, a little bit of background of the Minnesota Student Survey. It's actually been ongoing since 1989, and it's conducted every 3 years. At the beginning of the survey, grades 6, 9, and 12 were responding to it, but in more recent years, since 2013, grades 5, 8, 9, and 11 have been responding to the survey. For 2019, 81% of school districts in the state of Minnesota participated, and all Scott County districts in 2019 participated in the Minnesota Student Survey. Here's just a summary of the topics covered by the Minnesota Student Survey. Not all students are asked every question. For example, fifth graders are not asked as many questions as the older students. So in the rest of the presentation, I'll go through kind of a quick summary of places where Scott County students are doing well and areas where there's room for improvement. So the first category is demographics. Here is a picture of how students reported their own race and ethnicity. So largest percentage was, of course, white, followed by Asian. And then actually the third highest group reporting was 2 or more races. That was followed by Hispanic, Black and African, and American Indian being the smallest categories.
And this data is just for Scott County, correct?
Yes, but this is how the students reported their own, so
Yeah,
it might
in
not
Scott
match
County.
up with
I get it.
official statistics.
Thank you.
Next category is home and family. So students answered the question, how much do you feel your parents care about you? And this is students who answered quite a bit or very much. So we can see that across all the grades, there's a fairly high percentage of students who feel that their parents care about them. The next question in the home and family category is students who answered, I feel safe at home. So this would be students who agree with that statement. And again, we have very high percentages of students who report feeling safe at home in all the grades. Moving on to the next category is school. And here we see students who reported being bullied once or more in the last 30 days. So for 5th, 8th, and 9th grades, that percentage was actually over 50% for Scott County students. And it did drop to about 40% for 11th grade. And we're hovering right around the state rate for the bullying. And same thing with, the same thing with physical appearance and size or weight being the most common reasons for being bullied among Scott County students. For the school category, students also answered the question, at my school, teachers care about students. We see in all the grades, over 85% of students report that their teachers care about them. And then students feeling safe at school was the same thing. We see very high percentages of students feeling safe at school across all the grades who answered the survey. All right, our next category is health. First, overweight and obesity. So this is based on body mass index, BMI. We see about 1/5 of students in 8th, 9th, and 11th grades were overweight or obese when they responded to the survey. This is lower than the state of Minnesota. And looking over time, we can see that the percent of students who were overweight or obese actually increased between 2013 and 2016, but we've seen a decrease now since 2016. These are all based on the Minnesota Student Survey. So when the students took the survey in 2013 to 2016 to 2019, we did see the increase, but going back down again now. Physical activity, here we can see the percent of students who were physically active for 60 minutes or more for all of the previous 7 days. So anywhere from 15 to 23% of students in 5th to 11th grade reported being physically active for 60 or more minutes on the previous 7 days. This is important because the CDC recommends that children and adolescents aged 16 to 17 do 60 minutes or more of physical activity daily. So we can see that there is still quite a number of students not meeting this recommendation in Scott County schools. On the other side of the spectrum, in the green bars here, we can see the percent of Scott County students who had 0 days of physical activity in the past 7 days. So a significant chunk there. There's, of course, students that fall in between these two categories of 0 days and 7 days. But this highlights where there's some area for improvement.
Can I ask, Madam Chair, back on that slide and that physical activity, don't these kids have Fayette at school?
Yeah, yeah, and they wouldn't have it every single day.
For 60 minutes or
Yeah,
more.
for 60 minutes, yeah.
And some grades don't, or you don't have it all year round, or all the semester. Has this data been, getting better, worse over the past few years? Do you know that?
We would have the data from 2013 and 2016. I don't have it on the slides, but I will definitely get that to
Be
you guys.
interesting.
Yep.
Thank you.
In the healthy eating categories, first we will look at fruits. So in these graphs will show the percent of students who eat less than 1 serving of fruit per day. So we actually want to see decreases in these graphs. We want to see decreases in the number of students eating less than 1 serving of fruit per day. So beginning in 2013, we did see a decrease in students eating less than 1 serving of fruit per day for all categories except 11th graders. But from 2016 to 2019, that's started to go up again slightly. Not a huge change, but we do see that trend reverse a little bit from 2016 to now. With vegetables, this is the same thing. We want to see a decrease in this as well. So beginning in 2013, fairly stable. We have 9th and 11th graders increasing, but 5th and 8th graders decreasing in their vegetable consumption, but it stayed pretty stable since 2016. But it's important to note that this is still about 50 to 60% of students eating less than 1 serving of vegetables per day. Next is mental health. So this shows the percent of students who have often felt depressed or hopeless in the last 2 weeks. This feeling among students increased. There was more students in 8th grade and 11th grade who felt depressed or hopeless in the last 2 weeks. But 9th graders actually improved slightly from 2016 to 2019. And the percent who considered committing suicide in the last year has remained fairly stable and actually decreased a little bit for 9th graders. So we didn't see a huge change in that. And now emotional well-being. Here we have the question, I feel good about myself often. So this is students who often feel good about themselves. In 2016, these are the percentages of students who feel good about themselves often. But now looking at 2019, for all the grades, that actually decreased. Actually a pretty large decrease among 5th graders especially. Another measure of emotional well-being was students answering the question, I feel valued and appreciated by others often. In 2016, these are the percentages of students who often feel that, fairly high there. Going to 2019, we again see those same decreases. And also we have adverse childhood experiences, or ACEs. These would be traumatic events for children. And these are the percentages of students in 8th, 9th, and 11th grades who have experienced 1 or more adverse childhood experience. So around 50% of students have experienced at least 1, and that seems to be increasing between 8th graders and 11th graders. And the most commonly reported ACEs were living with someone with mental health issues and living with an adult who regularly insults or puts the student down. So these are the most common among other ACEs that they could have experienced. All right, our last category is substance use. First, we'll look at cigarette use. So this will be the students who smoked a cigarette at least once in the past 30 days. For 11th graders, it went down. And for 9th graders, it also went down. And for both of these, we are actually below what the state rate is for cigarette use. Marijuana use in the last 30 days, we see it go up for 11th graders, and it's right around the rate for the state. 9th graders, it goes down a bit and below the state rate. And then in 8th grade, it stays about the same and again below the rate for the state of Minnesota. And next is alcohol use, so students who drink alcohol at least once a month. 11th grade, we see that go up, but not too much, just 19% to 20%. But we are quite above the state of Minnesota rate for that. The rate of alcohol among 9th graders went down right around the state rate. And finally, for 8th graders, it did go up slightly, but not a huge increase. And next we have vaping. So this is students who vaped or used an e-cigarette at least once in the past 30 days. For 11th graders, we see a 11% increase from 2016 to 2019. And that 29% of 11th graders who report vaping, that is higher than the 26% of 11th graders in the state of Minnesota. For 9th graders, the rate of vaping also increased again quite a bit, but this time we're pretty equal with the state. And then finally for 8th graders, that increased as well. And now we'll look at alcohol and vaping access. So where do students get access to alcohol or vaping materials? Students who drank alcohol in the past 30 days most often reported getting that alcohol from friends or parties, taking it from home, their parents, or someone else buying it for them. And then for vaping, students who vaped in the past 30 days most often reported getting alcohol from friends, a vape shop, or someone else buying it for them. And now we'll look at how risky do students think these substances are. So actually for marijuana, 56% of Scott County students thought that using marijuana once per week was moderately or greatly risky. And a similar rate for vaping. So 58% of Scott County students thought vaping was risky. After these two, students start thinking substances are, this risk perception increases. So 73% of Scott County students thought that drinking 5 or more alcoholic beverages once or twice per week was risky. For cigarette use, 84% thought that cigarette use was risky. And then 84% thought that prescription drugs not prescribed for them, that use was risky. So that was a very quick summary of the plethora of data that's available in the Minnesota Student Survey. And that is all I have for you today. So thank you again.
Thank you. Any questions? Commissioner Beer?
Yeah, thank you. Can you go back to the slides where I think it was the emotional, there was two that were
I
sort
have
of.
emotional distress and emotional well-being.
Yeah,
So
maybe it was that. I think it might be, go one more forward, I think. Maybe two more. It was trending and not the good. Okay, so you get, I feel good about myself, and the next one was, you know, appreciated by others, sort of parroting that. So we've got this data, and you guys are the experts in the field, right? I mean, so what are we looking at? Here's the data. So we're looking into this. What are you seeing? What's the, you know, I like my silver bullets. What's the why? Any educated guesses, guesstimates on, I mean, that's,
Big deal.
yeah, I mean, I know some, you know, I mean, it is a big deal. So we're gathering this data, we're doing all this effort. What is this telling us?
that is a great question. This being quantitative numbers, we don't get that why. So starting with this quantitative basis and looking at the trend over time, it definitely points us in where to even look in the first place. So I'd say now that we've seen this decrease from 2016 to 2019, it would be a great time to start looking more into that why and getting more of those details and stories of what is actually going on. Because we see these numbers, but we don't know the story behind them as of right now.
Yeah, I'm a why guy, so I like the why. And it's a big deal. It just, I don't know if it's just extra confusion in the world these days, or, I mean, that's in that period of
3
time,
years, that's a big decrease.
that's a big deal.
Yep, and we can look at other things that are happening across the country. We know that there's a lot of mental health problems going on across the country. We know that isolation and even social media are contributing to loneliness. So we can look to all these things as to what might be going on and then try to apply that to Scott County.
Thanks.
Any other questions or comments? Thank you, I appreciate, I know this data just came out, so I'm sure it was kind of a rush to get it ready for this meeting, and we're gonna, I'm sure, hear a lot more about it in the year to come with plans for action, so thank you.
Yep, thank you.
Other bad stuff.
Well, good morning, Commissioners.
Morning.
Let me say it's a pleasure for me to have an opportunity to come back and be part of this fine organization's work. You know, one thing that we've reflected on relative to your question, Commissioner Beer, You know, I think our society is becoming more socially isolated than it ever has been before across all age groups. And I think that certainly equates to some degree with some of this emotional instability that we're dealing with in our society right now. That may be part of what we're dealing with. Well, my task this morning is to review with you then some issues related to opioids and addiction and dependency on other types of drugs in our society. And if you look at why we are focusing on that within our county, within our state, within our region, and nationally, I think it's a theme across the board that we're having more and more issues related to these types of opioid addiction types of problems. So if you look at what we've done in Scott County, and we've gone to our residents to get a feel for what their concerns are relative to healthcare issues in our county, you can see that there is a trend in our county that certainly equates with that. And you can see from the years 2011 through 2019, there has been an increasing thought that we have more and more concern about issues related to alcohol and drug use, both in our young age groups and in our older age groups as well. And you can certainly see this in our graphic that we're presenting as part of our initial presentation this morning. If you look at opioids in our community and you know how that's impacting our present population base, in 2017, the crude rate of opioids dispensed per 1,000 residents in our county was close to 500, which is a significant number. And if you look at that as a big picture, 65,000 controlled substances were prescribed in our county in 2017. That's a huge number of drugs, opioids, that were prescribed within our county alone. It is a significant issue. Commissioner Wolf,
Wow.
It looks like you have a question.
Half the people, just about half the people of the county?
We're taking an opioid at some point. That is correct. Yeah. So it is a major, major problem. Now, you know, we've made some efforts certainly to address this, and one of the fine efforts we have in place right now is a concept of what we call take it to the box, where you can actually bring in these controlled drug substances to certain locales within our county and drop them off and get rid of them. And if you look at the numbers that have been in place over the last several years from 2011 to 2018, you can see that it has escalated significantly to a level that in 2018 there were 3,500 pounds of drugs collected in our county alone at this Take It to the Box initiative. Now, if you equate, what does this all mean health-wise? Well, you know, those of us who work in this kind of area of healthcare are concerned about outcomes. You know, what are the outcomes of this drug abuse type of problem and so on. And one of the things we look at then are overdose deaths that have occurred in our county, in the 7-county metro area, and statewide. And again, you can see over the last 17 years an escalating number of deaths related to opioid overdose types of problems. And this has occurred across the state. It is heavily embedded within our 7-county area, no question about it, but it is a universal problem in our state and in the region and the nation as well. Now, if you look at who in our population base is overdosing on these drugs, I want you to look at this graphic and look at the age groups that in particular are being impacted by these overdose deaths. Age group 25 to 34 and age groups 45 to 54. Now, you would expect those ages should be the most productive in their lives at this point, and we're dealing with drug abuse and overdose in those settings, which is going to impact their productivity and end up with long-term problems. So it continues to be a major problem, especially within those age groups that we're dealing with. Now, one of the drugs that we use in a setting where there is a drug overdose of a narcotic is a product called Narcan. It is an antidote that we can administer in several different ways. You can administer it through the nose, you can administer it as an injection, You can give it as a shot in a muscle group, or you can give it intravenously. And our EMS personnel now have Narcan available to administer at the point that they feel there is an overdose type of problem. So our first responders, our deputy sheriffs, our policemen, our firefighters, at the first sign that they may have an overdose from a patient they're contending with, have this medication now available to administer as an antidote that will resuscitate them to a point where they can then start to continue to get additional medical care. Now you can see that the number of Narcan doses administered in our county seems to, interestingly enough, have trailed off a bit over the last 2 years. I would suggest to you the reason, why do you think that is? Do you have any idea why that might be? Before I suggest to you what I think what the deal is here? Narcan's available now to the public. You know what I'm saying? So now if you have a family member that is a chemically dependent person on opioids, families are given Narcan to have available in that setting. Or folks who hang out in groups where drug addiction is a problem, they will have with them Narcan availability that they can pick up at any pharmacy without a prescription. And this, I believe, has curtailed perhaps the need for our EMS providers to be first on the spot to administer this drug. And I think we're seeing that trail off a bit then as a result of that. But if you look at Narcan administration across the board at various age levels, it continues to escalate, which again indicates to me the public has this Narcan and they're administering it. And you can see what age levels now in particular are being resuscitated. Look at that age level. 50. You know, the average age level for resuscitation of a narcotic now is about 50 years of age in our county. It indicates, again, a major problem at a point in a person's life where they should be most productive when they're chemically dependent on opioids, and it curtails their productivity to our society. All right, well, that's my piece here. Do you have any questions at all at this point about?
Thank you. Yeah, since we're on this topic, there's two things that specific to Narcan. Is it true that, I'm thinking of the public,
Yes.
okay, not our EMS because we're trained, but the public, that if they have access somehow to it and they're not sure is this person, you know, in need of it, that they can administer Narcan and there's no harmful effect if they didn't need that?
Yes.
Is that?
Yeah, that is correct, Commissioner. Narcan has absolutely no side effect to it in administration. So if you have somebody that's unconscious, and it's unclear if they're unconscious because of a narcotic overdose or some other problem, you can administer this product, and if they don't resuscitate, okay, there's something else going on with them. It has no side effects. I can tell you what we're doing right now is embedding into our treatment plan for folks who've gone into a cardiac arrest mode. One of the first things we're now asking our EMS people to do is administer Narcan in that setting and see what kind of result you get.
And the second question, if I may, on that same topic, you talked about groups, maybe, you know, known, I mean, they're drug users in a group. Is there a law, I'm looking to our sheriff too, where if somebody overdoses, that they can call for help and there's no
ramifications legally for them to do that.
So if they're using drugs themselves,
Yep.
someone in their presence ODs, they can call 911 and
Yeah.
don't have to worry about, they can save this life without worrying about going to jail, as I understand it.
That is correct. That is correct. One thing I find interesting, what we're finding now in cultures where this is a problem, and they're shooting up, they're overdosing as a group, they may have one person that doesn't do that has Narcan available. Okay, so they're watching that. And then also some of these drug suppliers now are actually giving out Narcan with their drugs, so that they can shoot up to as high a level as they would wish and then still have Narcan available to bring them back.
But I don't know if I want to ask this publicly, but can you go, I mean, you can OD to the nth and Narcan will most, I'm looking at Luke again here, but should be looking at the doc,
Sure.
will bring you back? I don't know if I...
Yeah, I hear what you're saying. You need to administer larger amounts of Narcan depending upon the potency of the product. But I think what we're finding is if you have folks that are really chemically addicted, they'll shoot for that ultimate high, and having Narcan available gives them an opportunity to shoot up to a higher level and still be resuscitated.
So we've gone from designated drivers
Yeah.
to now designated dosers, whatever, I don't know.
But I think it brings us to a point then where we need to think, okay, if we resuscitated these folks, how can we get them into a treatment plan that will continue to keep them sober if they wish to move down that pathway? That's what we're looking at now. Okay, thank you.
Any other questions for Dr. Wilcox? Thank you.
So on the topic of overdose deaths, just to tell you a little bit more, we saw some of those metro statistics. But what it looks like here in Scott County, since 2000, we've had 66 opioid-involved overdose deaths, 16 heroin-involved overdose deaths, 12 cocaine-involved, 18 benzodiazepine-involved, and 7 psychostimulants. And that's since 2000. So it's not just opioids that we're looking at. But as far as opioids go, the numbers are increasing because we also know that in 2017, we had 35 non-fatal emergency room visits for opioids, and in 2017 it was 33, and in 35, and in 2018 it was 33. Those are just for opioids, so we know that's increasing. So we did see in the resident report, I mean, the community is aware of this. That clearly is echoed in the resident report. Also in our community health assessment, for the first time ever, not only did substance use by youth and substance use by adult get on the survey as we are recognizing this as an issue, is that it became the number one issue that our residents were reporting. So as part of the community health improvement plan, in response to this, we've created an action group to try and figure out exactly what we plan to do about this. We don't actually have a really cool name for the action group yet, so right now we're calling it Alcohol, Tobacco, and Other Drug Action Group. It's a little bit long, so if you have any suggestions, let us know. We have created a detailed action plan. We recently, it's about 17 pages long. We recently merged that down into one page. I don't have the whole thing for you here today, but some highlights. And we are really taking a broad look at the group and encouraging membership from not only public health, law enforcement, and government, but also existing programs such as Choose Not to Use, the hospital and medical community. Schools have a role there, the tribe is on the group. Health plans, CD treatment, and faith communities and others are joining as word gets around. We did take a broad sweep at first and created this long work plan, and then I got a hold of the prevention tools, what works and what doesn't, and started crossing things off because we did have several things on there, such as scare tactics is proven to not be an effective strategy. That would include like the crash demo at the school, which we still continue to use that, but it really actually can have, has been proven to possibly have some harmful effects on children, including creating some trauma. So we've broken it down into several strategy areas. These are evidence-based strategies, such as providing information, with the goal of increasing knowledge regarding those dangers and consequences of ATOD use, and hopefully trying to impact some of those statistics we saw from the Minnesota Student Survey of kids who think it's not dangerous to smoke a pack of cigarettes a day, and it's not dangerous to share your medication. So really focusing on trying to increase that perception of harm. Some of those action steps that we'll look there to be using are the Community Readiness to Change survey to identify where our community is at, as well as informational brochures, posters, and presentations. Focusing on the area of enhancing skills, we really want to be able to give youth some opportunities to increase their refusal skills to drugs. We know there's a lot of peer pressure out there related to using alcohol, tobacco, and other drugs, as well as giving parents some additional skills to store those medications in a safer way if they do have opioids at home for a medical need. There are a variety of programs already in our community, such as Change to Chill at the hospital, the Courage to Speak that Choose Not to Use is currently providing in the schools, Campaign for Tobacco-Free Kids. So it really is kind of coordinating those programs and maybe looking at some other evidence-based skills to address some of our specific issues in our community. Providing support, so really increasing community collaboration for prevention and intervention. Partnering with chemical dependency counselors in the schools to provide activities in the curriculum, and as well as building some referral networks that we are lacking a little bit in our community of where we can send people for treatment or other support networks. A big issue is reducing access. How do we reduce the amount of the leftover drugs? We saw some of those numbers, they're huge. We have over 60,000 pills in our community. We know very often people don't finish their medication, and they're often leaving it in their medicine cabinet at home for later use. So really focusing on teaching parents about how to get rid of those medications safely, either take it to the box or there's other programs out there. Some other action steps, looking at alcohol and tobacco compliance checks. Currently, we partner with some of the police departments. Public Health provides the Congratulate and Educate program, where we have very few fails. So we have kids going in and trying to buy for tobacco. We've been pretty successful in having very few fails, and the police also do those as compliance checks. We don't ticket, but they do, and we're pretty successful. And also, a new strategy that was suggested is really engaging those hotels and motels in conversations about underage alcohol use, particularly around prom time, where kids are getting their adult friends to rent a room and they have a big rager. Changing consequences and disincentivizing alcohol, tobacco, and other drug use. Looking at things such as letting parents know about the social and legal consequences of alcohol use or providing alcohol to minors in their home. More education about the social host law. Also utilizing health insurance to try at claims to really identify possible alcohol misuse data, overprescribing by physicians, et cetera. And kind of really increasing some of our social norms that would discourage use. Another tactic is changing that physical design. So that's our policy, systems, environment area. Modifying policy design to really decrease that marketing of tobacco and e-cigarettes. We know that's a big issue. We ask kids also, why are they using e-cigarettes? And they report that if it didn't have flavors, they probably wouldn't even try it. So looking at policies that change kind of the environment of those retail stores and retail sales, which is connected to the next one. A change in law. We recently met with some policymakers who are looking at doing statewide T21. Until that time, it's not available in our community. Possible tobacco-free parks and smoke-free housing policies we can take a look at, which were suggested by our action group. More to come on that. And then really that preventing overdose. Increasing access to the opioid antidote, reducing stigma, increasing resiliency in our community, expanding those collection opportunities, providing additional naloxone, Narcan training, as well as airway management for families, because we know that that's also, you still can give someone Narcan, but it's not a pretty thing, and you also need to know airway management in order to save that individual. And then also, a lot of those first few were prevention tactics, but also tying in some early intervention and treatment and recovery support. What are our resources? Increasing knowledge of what the treatment resources are that are available. Expanding access to those in our community. Right now, I understand the only methadone replacement program is in Burnsville. So what if there's transportation issues? Is there some support that we can provide for those that need methadone or Suboxone to try and continue those programs that are proven to be successful? What can we do to support our residents in order to ensure that they have that service available? And teaching providers where to refer and follow up. So all of this does cost money, and I'm a little saddened that Commissioner Beard isn't here today giving me the face of who's going to pay for this. But we do know that funding is needed, and as you recall, we have applied for the Drug-Free Community Grant for the past couple years, and we were not successful the first 2 years. But I'm extremely pleased to tell you that after the third try, third time's a charm, we were awarded the Drug-Free Communities Grant. So what that means is we're going to get $125,000 a year per year for 5 years, so that's $625,000. That will fund a 1.0 FTE to really kind of coordinate the work of the coalition. And this, again, it's not just the county, this is a community response, so they'll coordinate those efforts. It will also include a .40 FTE prevention assistant for Choose Not to Use to help work with the schools and get them those resources that they need and coordinate it. This grant is from the Substance Abuse Mental Health Services Administration out of the White House Office of National Drug Control. The cool thing about it also is that it is renewable for another 5 years after the first 5 years. So we have 10 years to try and make an impact. And I know it's easy to figure out, but I'm really excited to say $1.25 million over 10 years to really support our Scott County efforts here. So more to come on, and more to come on that, and we'll be bringing progress to you regularly once we kick off the program. And that's all I had, so if anybody has any additional questions.
Commissioner Beer?
Me again, thank you. You had mentioned that scare tactics are shown not to work, and you use the example of I call it the mad car, was always the mad car.
Mock crash or, yeah.
Is that true?
It was in that book.
Well, if it's in the book, if it's on the internet, then of course it's true, but.
Must be on Facebook, too.
Right.
I read it.
Right.
No, evidence-based research indicates that those are not successful. It does not have any positive impact that they can measure. It has measured to have negative impacts. So, and especially if, I know we had a recent car crash death in Shakopee. They were concerned about trauma. They did continue to have the program, but the evidence indicates that that does cause further trauma. So we'll have to take a look at those. We created a whole bunch of wonderful posters that had really some scare tactics that we were using in our posters related to drugs, and we're going to be trashing those because it's not effective.
And you're the expert, I am not, but I would encourage you to challenge that specific piece, because I get the scare tactic piece, I get that, but that mangled car, that's a picture of reality. That's not like a manufactured scare tactic. So I would, again, I don't have the data, but in my own anecdotal, I would say that is an effective, I get it, somebody could see it and be triggered by something, but what if the chance of 1,000 kids seeing it and being like, whoa, that makes a difference. That's my only, you're the expert, I would just ask you to challenge that data specifically as it relates to that car.
You need some more proof.
Well, I've just heard and have seen people impacted, at least in the moment, by seeing something that's real, that could happen. I'm not saying create a scary poster and this, stuff happens.
Yep. I'm happy to pull the research for you, and because I was very surprised by that as well. There are a lot of programs that people use regularly that have no positive effect. For example, Dare to keep kids off drugs. That really does not really work to keep kids off drugs, but it does have some positive effects, unintended, that it works to help build relationships between kids, youth, and the police, which was unintended, but I think that's a great outcome of that program. But yet we continue to use, some communities will still continue to use Dare. But I will certainly can pull some more research and take a look at that, because honestly, that one did really surprise me that mock car crash had no positive effect, measurable.
One part of me wonders if sometimes our best outcomes were originally unintended. So I, leave room for that too.
Any other comments or questions? Yes, Commissioner Ulrich.
We are going to have a coming debate across our state on the legalization of marijuana. And I'm worried about that. I'm wondering about that. I'm wondering what kind of information can we expect from community health or law enforcement to inform us in the debate?
Well, we are preparing for that. I'm a little scared myself, personally. Yet we know that kids who smoke marijuana are about 25 times more likely to try opioids. So whether the science is, whether it's a good or bad thing, we know that it does lead to, it's a gateway or bridge drug, as Dr. Wilcox refers to it. So we're going to be putting together some information. We already have some posters related to marijuana, and it's really tying it to more of educational success. If you're smoking marijuana now, where do you see yourself in 5 years? Because you're not going to go into law enforcement. Maybe you won't graduate high school. Maybe you're not going to go to college. So really kind of trying to tie it in with choices and decision making. I'm sure that, we know it's coming. To be honest, I think it's probably going to be within the next 2 years that it's going to be legal. We here in our county can make some policy decisions related to, are we going to have sales? Are we going to allow anyone to grow marijuana in our community? So there are some things that we can do. We want to do it now. We can also include policies in our indoor air related to smoking marijuana. We're going to have to take a look at what does that mean for our staff if marijuana is legal and they're smoking it on the weekend, because they may likely still test positive for marijuana over the next 30 days. So there's going to be a lot of information that we're going to have to provide and have a lot of discussions. The police are going to have to kind of figure out what are you going to do about driving under the influence of marijuana, and how are we going to test for that. So it does open up a whole host of questions related to that.
Well, for example, I'm aware of one jurisdiction where law enforcement realized that they were going to lose the debate on legalization, so they would say they kind of withdrew and didn't stay engaged, and that was a mistake apparently. They felt that even though they were going to lose the overall debate, they still could have had more influence on how things shaped out.
Right.
Continuing into the implementation. I don't know,
Yeah.
is that true?
Yes, that's true.
Okay. So we need information. We need to not throw up our hands and give up on a debate.
Absolutely. And I think we can have some discussions starting now. Maybe in the near future, we can do a workshop on what are some of the consequences, barriers, policies that we can pass, take a look at to kind of get in front of it before it happens.
Madam Chair and Commissioner Ulrich, I think the plan was that going into the new year, we would have public health, there's zoning and land use, there's law enforcement, there's the attorney's office. There are a whole bunch of different realms, I think, that we need to present information so that we're educated as the topic moves towards the legislature. Claire's talked about it, not believing it would be in 2020, but post that. And so I think the education so that we can talk about it from all these different areas is one of the plans we have moving forward in 2020, some work sessions in that area.
It would certainly be a scale topic, I would think.
Yeah. Thank you. Any other comments or questions? I have just two. First of all, thank you. Thank you for the good report and the data, knowing that this is a Community Health Board report and it's getting us the data. It should influence us as we work on finalizing our strategies for the next coming years. And then second, I just want to comment on the Alcohol, Tobacco, and Other Drug Coalition. Again, this theme is throughout our work, but very happy to see that it includes such a wide range of community members, because even though we're concerned from a county level for all kinds of reasons, it impacts programs and things we do. This isn't just a county problem. This isn't just a government problem. So the more we can continue to build those coalitions, and I think from this board, we see that as some of our role, helping build the coalitions, but we can't solve those problems. Right. And we want to continue to do that and build those coalitions. So thank you for that. Any other business to come before our Community Health Board meeting? If not,
Motion to adjourn.
Second.
it's been moved and seconded to adjourn the Community Health Board meeting. Any discussion? Seeing none, all in favor, please say aye. Aye. All opposed, same sign. Motion carried, the meeting's adjourned. Thank you. All right, we will convene our county board meeting in just 1 minute. If anyone needs to leave, they can go, and I think we have a few people outside coming in. So, do you need a minute? Are you good?
Well, you want to take 5?
If you need to, but I think this will go pretty quick.
Okay, get the vets lunch.
Okay, sounds good. So just get these people out.
You have? What?
The jurisdiction I was referring to was Colorado.
Yeah, I figured as much with your son. Yeah, we started talking about that.
So there's no sound even going over the streaming right now? All right. All right, I may announce that just so people can tell other people. All right. Good morning. I'd like to convene the November 5th, 2019 meeting of the Scott County Board of Commissioners. Please join me in saying the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. A couple announcements. First off, Commissioner Beard is out of town this week and is not joining us. We miss him greatly. Secondly, we've just been informed that the streaming of this meeting, the sound is not working. So if you hear any comments about that later, we know we're trying, and we hope that the recording will happen and we'll be able to get that uploaded. So are there any amendments to the agenda? If not, stand approved as read. Next item of business is to approve the minutes of the October 15th, 2019 County Board meeting.
I'll move approval.
Second.
Been moved and approved to approve those minutes, October 15th, 2019. Any discussion? Seeing none, all in favor, please say aye.
Aye.
All opposed, same sign. Motion carried. Thank you. Now's the time on the agenda where we recognize any interested citizens. If you have a matter to which you'd like to speak to the board about that is not on the agenda, please approach the podium. We limit this to 5 minutes per person or subject.
Good morning.
Good morning, Mr. Meiser.
Will that show up?
Yep, there, we're getting it.
One copy for you.
All right, I'll read it and pass it around.
Good morning. Thank you very much for your guys' time. I appreciate it. Is it a ridiculous idea for me to assume that this political body here stands for truth and what is right?
We're not going to comment, but go ahead.
Okay.
Thank you.
I was handed a bill, and I sent a letter to the Sheriff's Department, and I asked them a question. I said, if you guys can verify this bill, I'll gladly pay it. I have no problem. And I've not gotten a response. And I cited the law, and the law was simple. And it says the county board may require that a person pay the cost of a person's room when confined. And so then I provide the definitions of a person, and I provide the definitions that this county has to determine if I'm a person. The Sheriff's Department used a Minnesota driver's license to identify if I was a person or not. Here's a copy of a driver's license application, and you'll see that if you turn it over, I don't know if you can see that, but number 1, it says that you must appear in person to take a vision screening test. It didn't say you are a person. You have to appear in man to take a vision screening test. You have to appear in woman to take a vision screening test? Sounds a little goofy, doesn't it? I have to pretend to be a person. And then it says, number 2, you must present evidence of identity. So most people think that's a birth certificate. But they didn't ask for your identity. It just says identity. So I want to show you something, because this has had very serious consequences for me. I know something. I know that this can't be that. It's just impossible. But I do know that this can appear as that. Clint Eastwood can appear as Dirty Harry, but he's not Dirty Harry. He just appears as Dirty Harry. So Clint appearing as Dirty Harry doesn't make him Dirty Harry. Same thing as this appearing as that doesn't make it that. Your statutes only govern a person. I showed you that I can appear as a person. But appearing as a person doesn't make me that. Now I took this challenge, remember, so this can never be that. So I took this challenge into court. And I was sentenced to 75 days in jail and fined over $1,200 for a simple traffic ticket that I could have paid in advance for $200. 75 days in jail for a traffic ticket. But I wanted to highlight the fraud of this and that. But Ron Hosevar and his team recommended that I spend 75 days in jail for my first time for a traffic offense. I got 2 more traffic tickets just like it. Second one was dismissed. No fines, no jail time, nothing. Third one, Ron Hosevar and his team decided this time that they were reducing the penalty and said no jail time, just a fine under $300. I thought repeat offenders, that it got worse, not better. What's going on? Now you guys want me to pay $600, this board wants me to pay $635 in jail fines for jail for pasties because you think this is that. And I've asked you, is this that? I know I appeared as that, but I'm not that. But now you refuse to answer me. If I'm a person, why do I have to appear in person? This can't be that, even if it appears as that. And it's fraud. Thank you, I'm almost done. And it's fraud to treat this as that. So how will you prove I'm a person? Will you tell me I must appear to be a person? Or will you just attempt to ignore this issue, call it truth, and ignore what is right? Are you just going to ignore what is right, what I've shown you here? I've said really simple. I'll pay it. I'm asking this body, is it my debt? Or is it the person's debt that I'm appearing as? See, the trick here is there's 2 John Misers. There's the John Miser I am, and there's the John Miser that I appear to be when I went through and got one of those. Because they told me I had to appear to be, and they told me I had to bring an identity that wasn't mine, because they didn't ask for my identity. They didn't say yours, but your mind puts it in there. So I've discovered a trick, and I think I'm done right now, but I would ask this board, because I'll come back here in 2 weeks to see if I get a response to my letter. To date, I haven't.
All right,
Thank you.
Thank you. We'll see you in 2 weeks. Any other interested citizens to speak to the board? All right, with that, we're going to move on to new employee introduction. Commissioner Beer and I had the privilege to meet with 4 new employees today. I'd like to call them to the podium to introduce themselves and tell us just a little bit about their position and what brought them to Scott County. Good morning.
Okay, you're right, it does seem very far away. Good morning, Madam Chair, Commissioners.
Good morning.
My name is Vanessa Strong. I'm the new Water Resources Supervisor in Environmental Services, partially replacing Paul Nelson, who just retired as the Environmental Services Manager. Growing up, I kind of divided my time between my grandparents' dairy farm in southern Minnesota and fishing in northern Minnesota. So instilled in me a very early sense of land ethic and a very strong love of nature, even since I was little. So I've been lucky. I've got to spend the last 8 years working in water resource management for both municipalities and watershed organizations. I also have 10 years of program management experience, and I'm finishing up my master's degree right now in a related field. I really do love the work that I do. I get a little passionate, and I might go off about science for a very long time, so you always feel free to tell me to limit myself, because of course if I love it, everybody will love to hear about it for a very long time. But I do also enjoy very much being a public servant, and I appreciate this opportunity, and I really look forward to serving the people of Scott County. So thank you.
Great, well, thanks for being here. We have plenty of water issues to keep you busy.
A little bit.
Yeah, all right, good morning.
Hi, I'm Stephanie Demule. I am the administrative specialist for the Sheriff's Department. I have lived in Scott County, Shakopee particularly, for the last 15 years. Have about 20 years administrative experience, but this is my first time in a government-type environment. So,
Welcome, thanks.
thank you.
Can I just add, that was excellent public
Oh,
speaking
very
right
good
there.
public speaking.
There's a little story there, so I'm not singling.
Good morning. I am Vicki Droman. I am a senior administrative specialist for the Sheriff's Office. So far, I am really enjoying it. It's a lot different from my previous 15 years of working for law enforcement because it was at a city or a municipality level. So this is my first time working for the county. It's a lot different than I expected, but interesting. So I am actually from Minnesota, but I've lived in Wisconsin the last 40 years, and now I am.
I know, we didn't even
I
get
do
to
not
that
have
question.
any Packers Vikings
We did
stories.
not even get to that question.
I know, that's the first thing everybody asks me. Okay, wait. Which team do you like? I like the color purple, but yeah, I've lived in Wisconsin a long time, so. But I'm enjoying
Be
the
more
area.
clear on that. That left it a little vague. A little vague.
Well, I have split children and best friends, so I try not to take sides.
So she's running for office.
Yes.
I am Switzerland, so yeah, no, but I'm enjoying the area and I appreciate the opportunity to be here.
Wonderful, well,
Thank
thanks
you.
for coming back home.
You bet. Thanks.
Good morning. My name is Nathan Dingler. I work at the Juvenile Alternative Facility. I've been there approximately 3.5 weeks, I believe. I do live in Carver County, unfortunately, but it's a quick little drive for me into Scott County. But I've always enjoyed working with juveniles in the corrections system. A lot of people don't get corrections, at least with juveniles. It's kind of a lot of these kids haven't had the opportunities that a lot of us had, and it's kind of giving them the opportunity to learn some new experiences, have some new opportunities for themselves, and really find the right way for themselves. I guess I come to Scott County bringing restrictive procedures that I've been trained with Hennepin County. And we talked a little bit about programs earlier in a different meeting, and I guess developing the older programs that we do have set in place, like DARE and the mock crash. With evidence-based practices, I think we have to also be ever-changing because our population is ever-changing, and we can still continue to use our programs that are implemented, but it's just we have to figure out ways to deliver these programs to our population.
Great.
Thank you.
Thanks, Nathan. Welcome to Scott County. So it was a pleasure to meet with these new employees, to hear about their enthusiasm and passion for the work, and we're just pleased that they've joined the team. So thank you. On to the consent agenda. These are items that have been previously workshopped, discussed, investigated by our advisory boards, and unless they're removed from the consent agenda, they will be considered in one motion. I will read the items and then we'll see if any need to be pulled. Item 6.1, to approve the request for an interim use permit to add a detached mobile home for full-time farm employment and infirmed family member, Richard and Michelle Marshall, applicants and property owners in Section 11 of Sand Creek Township. Item 6.2, to approve the request for preliminary and final plat of Plea Hall First Edition, consisting of one lot on 10.5 acres, Plea Hall Properties LLC applicant, and Estate of Lester Melkerson property owner in Section 16 of Louisville Township and four-way development agreement. 6.3, to approve the request for a conditional use permit to construct and operate a multi-tenant contract yard to include office, warehouse, shop, maintenance facility, and outside storage. Plea Hall Properties LLC applicant and Estate of Lester Melkerson property owner in Section 16 of Louisville Township. Item 6.4, to approve acceptance of family group decision-making grant funds in the amount of $80,749.12. Got to add that 12 cents. For FGDM services, January 1st, 2020 through June 30th, 2020. Item 6.5, to adopt resolution number 2019-156, approving a contract increase of $376,345.39 to Ames Construction Incorporated for the trunk highways 16941 and County Highway 7814 Freight Mobility Project in Jackson and Louisville Townships. Item 6.6, to adopt resolution number 2019-158, approving the basic sale price of a tax forfeited parcel, approving a private land sale to adjacent landowners, and establishing the date of the private sale. Item 6.7, to adopt resolution number 2019-154, approving entering into a joint powers agreement between Scott and Dakota counties for a pass-through of grant funds for projects in the Vermilion watershed in Scott County. Item 6.8, to adopt resolution number 2019-157, authorizing submittal of comments on the Transportation Advisory Board proposed regional solicitation criteria. Item 6.9, to adopt resolution number 2019-149, amending the compensation plan policy in compliance with IRS Section 451 and a tax doctrine known as constructive receipt, and rescinding resolution number 2018-194. Item 6.10, adopt resolution number 2019-150, adopting the emergency medical leave sharing program policy and rescinding the transfer of vacation paid time off PTO policy and resolution number 90070. Item 6.11, to adopt resolution number 2019-151, amending the leaves of absence policy and rescinding resolution number 2016-224. Item 6.12, to adopt resolution number 2019-152, amending the Juvenile Alternative Facility Program Supervisors and Facility Probation Officers Essential Non-Exempt Policy, and rescinding resolution number 2016-219. Item 6.13, to adopt resolution number 2019-153, amending the termination of employment policy and rescinding resolution number 2006-030. And item 6.14, to approve payroll processing of personnel actions. These are the 14 items on the consent agenda. Any that you would like pulled for further discussion?
Madam Chair, I'll move approval.
Second.
It's been moved and seconded to approve the 14 items on the consent agenda. Any further discussion on any of these matters or any additional comments? Seeing none, all in favor, please say aye.
Aye.
All opposed, same sign. Motion carried. On to item 7.7, to adopt resolution number 2019-155, proclaiming November 13 as GIS Day in Scott County. And presenting, we have, hi, how are you?
Hi, Tony Monster.
Tony, there we go. Couldn't get my screen up in time.
Oh, that's all right. And I don't think we have any graphics.
Okay.
I think we did submit the GIS and Next Generation 911 document. So this is our 4th year coming up for a GIS Day proclamation. In 2015, we took the opportunity to come up in front of the board to get our free and open data resolution passed. It passed, that's been a success. At that time, we were one of 6 or 7 counties that had passed such a resolution. Now at this point, I believe there's about over 30 counties in the state of Minnesota that have free and open data policy. Ours is an official resolution. They do to some respect. So that's been a great success around the whole state. We've also taken the opportunity to have this GIS Day to show off some of our applications that we released, do some showcasing of our technology as well in the past years. Their technology, GIS technology, moves pretty quick. So we use this day to kind of keep ourselves up on our toes and to let the staff and departments know kind of what's available for them to utilize and to utilize us for. So this year we are using GIS data to actually get together with our local city and township staff, GIS staff around the county. We have a good relationship with them. We kind of pride ourselves on that. We speak with them regularly. We swap data. We swap projects with them. So we're going to use next week, November 13th, to get together with them over lunch and just kind of discuss what everybody has going on, what data people are collecting, what projects everyone has going on, kind of a collaborative effort. So we like to keep in touch with them. We like to do a get-together about once a year, and so this will be our opportunity to do so. So one of the things we also wanted to highlight, and from the board while we have the opportunity, is that we've been doing lots of mobile work with our departments, mobile collection, data collection out in the field. We've been still continuing with our outreach to non-traditional GIS departments. We've actually been doing quite a bit with Lisa's group in public health, doing whether it's mobile surveys and then taking those surveys and displaying that information on maps that can have interfaces that you can interact with to get some further look into the demographics of our clients and our customers, and then how we can better allocate our resources for them. We have not been asked to map out any hotel ragers yet, but maybe that opportunity can arise.
I don't think she heard that.
So one of the other roles that we wanted to highlight, and this is work that we've been doing on for the last couple of years, and will only progress, is our work with addressing. So specifically, this talks about, like, we go into the this next generation 911. I don't know if I call it a project, because this is just where we're moving to with public safety. The last handful of years, we've taken on interns and taken these on as big projects to really get our addressing up to speed. The addressing is obviously very important for public safety, but it's also, we also use it for other departments. So we use it for when we had elections coming up, for our e-polls to make sure the addressing was there, for our property information, for mailings, like we talked about before with our demographics and county resource allocation. We got to make sure our addressing is correct. So this next generation of 911 systems are going to be utilizing geospatial data. So that means our roads are going to have our proper address ranges on them. So if you call up and say, I'm at 123 Main Street, we're going to know, okay, you're going to be within this block range. But not only that, now you're actually going to know exactly where that home is, and that's our address points. And if you happen to live on a big 40-acre parcel, that's a big property that, oh, you have to go to this property. Well, now we actually know where, with those address points, we know where your actual driveway entrance is to save time on those calls. Other data sets that we've been working toward are parks and trails, because you might have an accident on a trail, and they have to know how to get to you there. We have also, let's see, there's a lot, like I said, all the benefits of having this as spatial data. And the roads and these addressing aren't just important once you have families in the homes. That's obviously very important, but it's also even before that even happens, because you're going to have construction going on at these locations, so you can have accidents that we have to have emergency services get to, vandalism, thefts, all these things. So it's our role as the county to collect all this data, make sure it's up to speed, and to make sure it's accurate for our 911 system. So it's been taking a lot of our staff time and resources. Our whole GIS staff at some point is going to be working on addressing. We obviously work with our planning departments. We work with the local city and staff. We have our address coordinator, Jason Allen, who's been on top of this. And we're always just striving for this great accuracy in this data. So this project is ran by the state. And so the state's trying to roll up the work that the counties have been doing. The Metro, we've been ahead of this. We've been on the ball this for the last couple of years is when we really got our roads in place, and then our address points in place. And we do this as a Metro community because obviously roads cross county boundaries, address points, right? It's just nice to have that great picture of the Metro. So we work, I feel like the Metro GIS, it's a voluntary collaborative. So we just work together, and we have monthly meetings. We have get-togethers quarterly where we get together at the MESB building in St. Paul. Commissioner Brecky serves on the policy board. And I want to give you a quick nod because you have perfect attendance. So I want to say thank you for that because we are very fortunate to have great board support and management support for that. So this is a state-run project. We're just ahead of things, and we want to stay ahead of things because as we move forward with this next generation 911 system, it's dependent upon our spatial data, GIS data.
Wonderful. Thank you, Tony. Do we have any questions or comments?
I'm still looking for the drone.
Yeah.
Yeah, no
Around
cool
there someplace.
graphics or anything to show off today.
Yeah. Just a few comments. It's been really fun and interesting just to watch the development of this technology over the past few years, the development of what we provide to the public. The board made this decision before I was around about being an open data county, and I think that is a great service to our citizens, to our businesses. Many of them use this data, and it is public data, so it should be used and available. I think our department, our GIS department, just does a great job. You spoke of the linkages with the other departments. I think there's so much more we can do. That information can really help us as we work to solve problems and make things better. So I think a GIS day is a great idea. I think you've been doing a great job, especially with training for other staff and for other stakeholders around our county. So with that, there's a proposal for a resolution in front of us.
Madam Chair, I will make the motion to adopt resolution number 2019-155 proclaiming November 13th, 2019 GIS Day in Scott County.
Second.
Been moved and seconded to adopt resolution number 2019-155. Any further discussion or comments? All right, all in favor, please say aye. Aye. All opposed, same sign. Motion carried. Thank you, Tony. All right, we're moving on to item number 8, committee reports and commissioner updates. Commissioner Wolf, would you get us started?
Thank you, Madam Chair. On the 21st, the Bridges School over in Prior Lake, right just south of the Twin Oaks Middle School, had their ribbon cutting and a tour. Very nice facility there. After that, the Prior Lake City Council had a parks tour. Very nice, and Commissioner Beer was there. They've got a lot of parks. We didn't see, I don't even think, a third or half or a tenth of them, but they show us the ones that are in a lot of need of help over there. So it was very eye-opening to see, what they need and what kind of amenities the kids need for parks and things like that these days. And after that, the Prior Lake City Council meeting. On the 23rd, the Metropolitan Mosquito Control District met. Not much there. The mosquitoes are pretty much dormant right now. So I've had 12 days without a mosquito bite. The 24th, Vermilion River Joint Powers meeting, very quiet there. And then Elko New Market City. At that meeting, they had a little bit of a guest speaker there, the superintendent of Lakeville Schools, which serves about half of Elko New Market, gave a presentation on their referendum that is being voted on today. On the 25th, met with some legislators out at McMahon Lake, Eric Pratt and Tony Albright and some of their assistants, DNR person and a couple homeowners, and actually somebody, Kevin Shea from the WMO here, who lives on the lake, just to see what they can do as a permanent solution to getting the water out of that lake. And right now, their pumping is going on. It's down about, I think, 9 or 10 inches, so it's going down. They'd like to get to 12 by the end of November. The 28th, met with some folks in planning and zoning on a few issues, and then water resources on some water problems. Then the WMO meeting was held that day. It was Paul Nelson's last meeting. On the 29th, I just had a phone meeting with the administrator on a couple subjects. Last night, the 4th, Prior Lake had their city council meeting and workshop. They talked about water bills. And some of the bills are going to go up in Prior Lake because their costs have gone up. They also talked about the levy. They've taken off a few costs over there, so it's starting to go down. So the final coming in December. Credit River had their monthly meeting last night also, and big topic last night was the 2191 intersection, which the county here has done a study on, and we're going to have a little open house on here in the middle of the month, I believe. with the residents out there to see, you know, if it looks like a good plan or whatever. Been a few accidents out there, and a lot of them actually were not, you know, very, you know, one accident in March was a woman drove right through the stop sign, didn't stop, and, you know, everybody else stopped. So, there, you know, signs, I don't think are the problem. And then Cedar Lake Township last night, and it was pretty quiet there, just a few robberies happening out in the townships, especially Cedar Lake, and that's hoping they're getting close to catching the people that are doing it. So that's my report. Thank you.
Great, thank you. Commissioner Beer.
Thank you. On the 22nd, I had a meeting with Sarah from Extension. I think she's now in her second full year. She in her second full year?
Getting there.
And I knew I liked her because the very first meeting a year or so ago, somebody drove a van off the curb and she jumped right in and we tried to push that van. So I'm like, I like her. So it was just a good time to reconnect regarding Extension. That same day, we had chair, vice chair. Later that same day, Fish has been hosting, going around the county, different cities, and it was my turn with Mayor Briggs at Prior Lake hosting Fish, and I don't know, 20, 25 folks, I suppose, in attendance, some new folks I hadn't seen before. Always beating the drum for Fish, and as I'm looking down to my left here. 24th, we had the Fish Board meeting at Dakota. Thanks for hosting us there. On the 29th, got my first flu shot. Took advantage of our public health opening the flu. Everyone had their cameras on me. I think they thought I was in a whimper and cry with the needles, and I think I did. Is there some footage? There's some footage.
Did you faint?
Well, they propped me up, so I think in the film it looks like I made it. And I did not get sick a couple days after, so we're going to put that myth to rest, at least with one data point. So far, so good. That evening, attended the WeCan, what would you call that? Conference, weekend meeting?
Community conversation.
That one at
You
the
must have done the
Shakopee.
first half and me the second half, huh?
Maybe. Well, I was kind of in the middle. I had to do a hybrid. But I was there for part of the time at the high school. On the 31st, I barely made it to how I'm looking at Cindy, to the what would you call that? The first floor potluck, Halloween potluck, tenure awards. They said the food's down in down to the meeting room in the left. It was completely empty. They totally all the food stockpiled, and they sent me the wrong spot. I'm glad at least was able to at least make it, and I won't make any more comments. Who won? Who won? Do you remember who won? There was a contest at 10:31. Well, I won that one.
Oh.
As do you remember?
She was Corolla Deville.
Okay.
I hear you brought a cleaning instrument with.
Well, that's why I said I wasn't going to make any more comments than that.
I got third.
That's good. And what was
We were a family of witches and wizards, so I was the witch here today. She was awesome.
Yeah, I won't leave any, could have been a cleaning, whatever. I mean, the jury's still out on that. It's allegedly, by the way. It's allegedly. And then today had the new employee welcome, and with that concludes my report.
Thank you.
Thank you.
Great. All right, I was asking more about costumes, but let's let that go. All right, Commissioner
I went as
Albrecht.
Mike Beard.
Thank you. On the 16th, I attended the Transportation Advisory Board, and we talked a lot about things that are before us with the solicitation and the comment letter response to that. 17th, the Transportation Committee. The 22nd, the Live, Learn, Earn Complete Count Committee, which what that is trying to figure out how we would have less undercounts in the census, or strategies to get everybody taking the census. On the 22nd, the Fish Outreach Partner Relations Committee, and thank you again for Commissioner Beer's work with that and the Mayor Briggs. It was well attended and probably the best so far. 23rd, we had a Scale podcast. Mayor Williams and I went down to the League of Minnesota Cities and did a podcast. It was the first time I've ever done a podcast. I understand by extreme editing, they can make you sound smart. So I hope that'll happen. I'm going to hear that on the 11th and see how it ended up. On the 24th, the Fish Board. 24th, we also Scale went to Ramsey County, and in Roseville, we had a presentation of Scale. We had a mayor and a city county commissioner and a township officer in the school, district member, so we presented, and they're very hungry to hear about the collaboration, cooperation, and the values of scale, and how we work together. I was most pleased that they identified that the values, of course I told them, I said the values of scale, this slide you're gonna look at is the most important slide tonight. So I did say that, but later, you know, they could have disagreed with me and could have disagreed in different emails and stuff, but they said they were most impressed with the values of scale. You know, we did talk about accomplishments, and so you put it all together, they could have been impressed with the accomplishments, but no, they were really impressed with the values, because that's what really fuels the work of scale. And if we have those values of, you know, collaboration, partnering together, innovation, influence, and those are always before us, scale will do good work. And so they recognize that they got it. So I don't know, we'll see what happens there. But it's pretty exciting to have that presentation. And, you know, and what Tony Albright said, we were at the Scale Executive Committee last Friday, and we had some legislators there talking about legislative priorities. It was an informal dialogue on our legislative priorities. Tony said, you know, you don't realize here in Scott County, you just take for granted scale and the collaboration, cooperation that we have. And you just assume other places, other counties, other jurisdictions in Minnesota have that, or across the country have that. They don't. And scale is really counter-cultural in today's political environment. And we have to value that and recognize that. So that was pretty exciting. Okay, onward. 25th, the Greater MSP. 28th, the Suburban Transit Association. 30th, the Minnesota Valley Transit Authority Board meeting, and Scale Executive Committee, which I just kind of referred to. It was a little different format, where we intended to have this informal dialogue with the legislators just to get more of a back and forth, not a presentation as much, but, and then take that and then do the traditional presentation with scale together that we've always had. So it was kind of a two-step process on our legislative stuff with with scale. And then the fourth, Mobility Management Board. That's into my report. Thank you.
Great, thank you. Thanks for getting out and telling our story. For my report, on Wednesday, October 16th, I had a fun time. I co-moderated a panel with Paul Nelson up at the Minnesota Water Resources Conference. Our staff did a great job there. We had several staff members on the panel, several stakeholders from Soil and Water, from the DNR, from the University of Minnesota. So it was great to do that with Paul on one of his last days and see how well respected he is, and the work of our staff are all around the state. So we presented on a lot of the projects that have went on here in the past few years and the data that have been gathered from that. On Thursday, October 17th, I had the Scott County Library Board of Trustees meeting. We met out at Elko New Market Library. It's always good to get out to all our different libraries, see the different flavors and services offered there. Friday, October 18th was the monthly Dakota Scott Workforce Development Board meeting. We met at ProAct, actually, because Steve Ditchler is also a member of that board, so it was good to be out at ProAct, connect with some of those folks there, and for the whole board to have a tour at ProAct and see the things that are going on there. Tuesday, October 22nd, we had the chair-vice chair meeting, and also on that day, I did meet with Sarah Odenthal from Scott County Extension, Scott County 4-H, just to talk about current programming and nice, you know, she's nice enough to solicit our ideas for future and going forward. That evening or that afternoon, we had the Scott County Mental Health Local Advisory Committee, met out at CAP. We had a great presentation by Belle Plaine Schools and some of the work they're doing with students related to mental health. On Wednesday, October 23rd, I also attended the community conversation for We Can, but I was there for the last part of that conversation, so I'm glad we tag-teamed that without even knowing. A good turnout, I would say probably when I was there, a good 70, 80 people from the community, from all different types of groups. The theme of that meeting was really cultural competency and equity, and the goal of that group, of course, is to end child abuse and neglect in Scott County. So helping people really get together, work on strategies, learn things to work not just government doing that, but hopefully all of us doing that. Monday, October 28th, Leslie and I met at down in Belle Plaine with the mayor and city administrator of Belle Plaine, heard updates about projects going on there, new apartment building going up, some issues that hopefully will get resolved with the Dollar General and Casey's development. So it was just good to touch base, find out what's going on in Belle Plaine, make the connections that we need to make between the city and the county. Monday, October 28th, also was the Minnesota Alliance for Healthy Families Governing Board meeting. That's the joint powers group with a lot of our neighboring counties and jurisdictions that helps provide funding for our home visiting program. Also on Monday, October 28th, was at the AMC district meeting. It was good. Leslie and Claire also attended because there was some workshop type activities on transportation, trying to make sure that AMC is representing the goals and opinions of the members on transportation issues, because of course we have some discrepancies in how we want to fund transportation issues around the state. And so it was good to workshop. Just want to remind everybody, those two meetings, the spring and the fall, really open to all commissioners. Mike couldn't be there, so I was there in his stead, but some counties like Anoka, they have 5 of them there or something. So it's always good if you're able to go there, because you don't want me speaking on your behalf all the time. Just kidding. Tuesday, October 29th, that was the weekend one. What happened? October 23rd was the steering committee for that. So I made a mistake. It was the steering committee for weekend, and the 29th was the community conversation. I guess I went to a lot of meetings the last couple weeks. October 31st was MELSA Personnel Committee. November 4th, had my monthly meeting with our county administrator. This morning, I had a law library board meeting where we really talked about just kind of the interim here before a new law librarian is hired, how the library is being staffed, how the clinics are being continued. Jake has everything covered with his staff, but it'll be important to get that position filled and hopefully continue Mary's legacy and good work. And then finally, before the board meeting, had the new employee welcome. End of my report. Leslie, do you have an update for us?
Yeah, we have a couple things going on. So Monday, November 11th, just a reminder, the county will be closed for Veterans Day. The tax statements will be mailed out that same week as well, starting November 12th to our residents, so they can expect to see those in the mail. We then have a work session on November 19th that begins at 8:15. We wanted to have a time certain for Beacon and a time ending so that we could start the board meeting on the 9th, and we'll also have a work session after the board meeting that day. And then finally on November 22nd, we have your 2020 planning session, and I think you all have some homework from Deb that has come via email or will be coming that if you could fill out really helps move that meeting along. So appreciate that.
Great, thank you. County Attorney, do we have a need to recess for a meeting?
Madam Chair, we do not.
Thank you for that. Any further business to come before the board? Just want to announce that after this meeting, once it adjourns, we'll be meeting in a workshop setting to receive information on housing in Scott County. Motion to adjourn?
So moved.
Second.
Been moved and seconded to adjourn. Any further discussion? If not, all in favor, please say aye. Aye. All opposed, same time. Whoops. Motion carried. There we go. That was a little fast.